Hello and welcome to Tigray TV. This is another edition of Direct Talk. In this edition, I'm joined with Dr. Hagos Godefay, head for Tigray's Bureau of Health. And today we will be discussing about the issues of humanitarian crisis in Tigray. I'm Sablor Klema, and I'm your host for the day. Doctor, thank you so much for being here with us.
Okay, thank you for having me here.
Okay, so you've recently published an article on airstrikes in Tigray, and some of the numbers are quite shocking. 62 airstrikes from just almost all of them except for the Togoga massacre between October of 2021 to February of 2022. And you mentioned that over 1,000 casualties, in which almost 400 of them sustained fatal injuries. You've discussed about this in your articles, but how would you say the health system has been caring for these victims?
Yeah, as you said, by the way, the article was published in DivX, one of the big media journals in the globe, and the title was Tigray is demanding food and medicine, not bombs. We're demanding food and medicine, but they're sending us drones in airstrikes. For the reason I'm looking back since June, how many casualties do we have because of this airstrike? So, in fact, most of them were happened during the period October to January. But when we go back and look at the Togoga situation, it was really different, by the way. They were 244 casualties and 64 deaths. So we include Togoga and the overall, by the way, when we look at on the details, I can say it was really, by the way, shocking. The targets, predominantly the targets were civilian installations and infrastructures, like marketplaces, resident houses, hospitals, schools, and also refuge camps. So they were targeting the civilians who are living together. So it was really shocking. And we're trying also to look at the casualties plus the injured ones, by the way. When we look at the injured ones, there are more than 700 injured people. Because of the siege and the destruction of our health facilities, they couldn't get enough service because we're running out of orthopedic materials. So as many of them are developing permanent disability. So let alone to carry out this injury, still, laboring mothers are not even getting assisted delivery. So this for the health system is a triple burden. In addition to the destruction and the siege, they also bombed our civilians, our people, our hospitals as well. 3 hospitals were, by the way, bombed during the airstrike. So it was really difficult to mention, and was really also a big burden for us, for the health system, let alone to manage this. Even to address the simple ones is really difficult. We are in a difficult situation. Saying this, this for me is a collective punishment. It's not so. In the first place, they were targeting our health system deliberately. Secondly, for the last 8 months, I can say we are under siege. In addition to that, there is also airstrike. So this is a collective punishment. There's a continuation of the genocide. Still, the genocide is going on. So people are dying. People are suffering from shortage of drugs, from malnutrition, and also from airstrikes. So this is really the international community should really understand what's going on in Tigray. By the way, the other thing is Mekelle, the capital of Tigray, was bombed almost 13 times, attacked almost 13 times. In every attack, there are up to 2-3 incidents. So this makes by itself our people like to get frustrated, psychologically depressed. Our kids are, suffering a lot. If they heard any sound, they feel that as if the airstrike is coming and bombing again. So this creates, it's not only the injury, by the way. Beyond the injury, our people are really psychologically affected and really stressed because of this reason. So, in fact, recently there were also attacks in Shire town. They also injured like civilians, but we didn't address that, by the way. So still there are airstrikes, even though there is like discussion on the cessation of hostilities and peace talks, but still the drones are like, by the way, shielding us all the time. So this is really a bad situation, and still many people who are like, I can tell you, some of them, we can save them. We have like an orthopedic physicians. We have different professionals. They can support the injured ones because of the equipment they couldn't manage. So this is really big problem for the health system, and we can consider it a triple burden for the health system.
Okay. What about the state of health workers in Tigray? In your article, you mentioned that over 37 health workers have been killed, 78 injured, and more than 4,000 have been displaced or seeking refuge in neighboring Sudan.
Yeah.
How have the health workers been affected by the siege?
The effect of the siege on health workforces is really unbearable, I can say. But one of the achievements, the exemplary achievements in the last 27 years was, by the way, the increasing number of different health professionals to the health system. Like from the health extension worker until the subspecialty at either and the like. So we worked a lot, by the way, to achieve this. So before the war, when we look at the number of health professionals per population ratio based on the WHO standard, I can say most of them were like achieved. We were like gaps in physicians to population ratio. Otherwise, when you look at like the nurse to population ratio, the midwifery to population ratio, and the other professionals, we were on track. But after the war, it's not the siege only, by the way. Even during the 8 months war, most of our health workforces were like scattered, displaced within Tigray and out of Tigray. And many health professionals were seeking refuge camp in neighboring Sudan, still serving the displaced people in the camp at Sudan. So they are directly affected. It's not only that. Still, because of the siege, they are not like paid for 8 months, but they are striving day and night to serve the people. They are working day and night. They are committed enough without having food, without having salary, by serving the people, serving the people as a first priority. But currently, we've been reviewing, by the way, with the World Health Office heads and with the hospital heads, when we were trying to collect information from them directly. Many of them, by the way, they were like, especially in the rural areas, they were supported by the local community because they don't have food to eat and they don't have also salary. So they were like getting support from the local community as a contribution. The local community contributes like cereals from what they have. But now it's really difficult also for the farmers to provide the contribution because they don't have food to eat for themselves as well. So for that reason, many health professionals are like going to their homes, going to their families to get food. So they are obliged, by the way, because if there is no food, how can they stay at the health facility? In the first place, they're frustrated, by the way, because of the distraction, because of the siege. In addition to that, they're also suffering from shortage of food. So they are in a big trouble. To solve this problem, we've been initiating one initiative, Life Support for Lifesavers initiative. We have also communicated the diaspora people, the Tigrayan diaspora people, and other friends and supporters living abroad. They are willing to support, by the way. They are like mobilizing cash and resources. The problem is, since there is no bank, the bank service is already closed, there is no any communication, so they couldn't send the money, the cash, to Tigray because of this reason. So we are totally in a big trouble. Still we're working, still we're encouraging our health professionals to help the people. By the way, one of the interesting thing, what I saw and what I learned in the past months was, you see, the health professionals are not like working on only their based on their profession. They mobilized chairs, tables from the local community, because as many of the health facilities do not have chairs and tables. They repair themselves, by the way. So they are like creating innovations. You know, so they're struggling to serve their people. They're going to every farmer's house as a mobile health team to provide education and counseling at household level. So the commitment is really amazing, by the way. But because of those reasons, they are still a problem. We're looking different support from different people. So we will see what to happen. Otherwise, they're really suffering from, the most difficult thing is, by the way, to see people dying, children's dying because of starvation in front of you, while you are able to manage the disease. This is very difficult, by the way. Many of them are like fainting during providing the service, especially in the hospitals. Mothers are dying in front of them because of bleeding. This by itself creates, by the way, deep frustration. But still, they are committed to serve. And using this opportunity, I would like to ask the international community and call the international community to help our health professionals to provide the service, at least, and to survive. Not only to provide, by the way, to survive. We have invested a lot, by the way, to make this happen. But because of this reason, our health professionals are suffering a lot.
In addition to this, I also want to ask you the situation of women in Tigray, about how they've been denied their reproductive rights. They could not get contraceptives and such. So how is the siege affecting the reproductive rights of women in Tigray?
The main vulnerable groups, I can say, are children and mothers. If there is no drug, if there is no food, those who are highly affected are, the mothers and the children. In the first place, by the way, we're asking the international community to answer our demand based on the Universal Declaration. It's written as an article. Health services, by the way, it's considered as a basic need. It's already signed as Human Rights Convention. So every woman has the right to get family planning service. She has a right to get delivery service, antenatal care service, and the like. Because the mothers are like denied, many mothers are dying because of bleeding. There is no transportation, ambulance transportation. We had about 312 ambulances. 60% of them were, by the way, bought by the contribution of the community. Every health center has its own one ambulance. So almost 60 up to 70% of the mothers were assisted by ambulances. But currently, we don't have the ambulances, as majority of them were looted and burned. In addition, we don't have fuel. For those who have ambulances, they don't have fuel to transport. For that reason, mothers are dying at home while giving birth, while giving life. This is really unacceptable by any moral standard. So it's a human right to get a family planning service, is a human right. So mothers should stand, by the way. Mothers everywhere. We are, these days we're celebrating, by the way, March 8th, at global level and at national level. So we have to consider this, by the way. While we are looking for basic services, life-saving services, mothers in the globe are like celebrating March 8th. This is really amazing, by the way. So please, you have to act. You have to support the mothers in Tigray.
When I move on, I want to ask you about the article you published on Ethiopian Insight last month. You had stated that your bureau was able to register 5,000 deaths between July and October, and of course related to the ongoing siege. What can we expect if the siege is to continue?
Basically, this is, by the way, one of the interesting articles published in Ethiopian Insight. It was like published in January 26, I think. In fact, you know, the data, when we look at the methodology, I think this is really very important. Unless you understand the methodology, simply people can be biased, by the way. The data were, by the way, collected by our partners, the implementing partners. In the first place, when we are like discussing about this issue, you know, we developed a format together with our implementing partners working in Tigray, the UN and the implementing partners as well. So after we finished the format, we give the format to all the partners to collect the data from their respective project sites. It's not the Tigray Regional Health Bureau who collected the data. It's the international partners who collected the data, by the way. So the plan was like to collect the data from the entire region. But unfortunately, because of the communication, because of the transportation access, they have already collected from 40% of the sub-districts. Sub-district is like the lowest level administration with a population of 3 up to 5,000. So they collect 40%, and for 4 months only, from June to October only, by the 4 months only. So it doesn't include like November, starting from November until January. So when we look at the number, it's really frustrating. More than 5,421 days. All the days are like registered. We have the list of the days by address, by age, by sex. So if anyone wants us to check, they can come to the office so that they can directly get the information from our office. So it's 5,421 in 4 months' time from 40% of the sub-districts. This doesn't include the western zone and part of northwest and eastern zone. Areas still under the aggressors, by the way. This doesn't include that. If we include that, and if we like consider the entire region, you can imagine how much people are perished because of malnutrition and shortage of drugs. By the way, we're trying also to look at the possible causes. Amazingly, more than 95-96% of them were like preventable diseases. Like 32% of them were like communicable diseases, 29% malnutrition, and 29% non-communicable diseases. So people are dying because of shortness of drugs and starvation. So this is really a very important article, but in fact, still we're working on it. We are also collecting data, by the way, recently. We have discussed with partners to consider the other part of Tigray and also to look at the 6 months days report. So we're publishing based on facts, based on evidences. So as I was trying to mention earlier, if there anyone who wants like to check, they can come and check exactly how many people are like perish in every day. This is the routine activity at the moment. By the way, we're counting the number of days as a routine service because of this problem, by the way. So those of you who want to read more, you can directly check in Ethiopian Insight so that you can learn more. And if you have any question or any issues, you can send us through our emails.
Okay, so there seems to be a lot of buzz around the entry of medical supplies into Tigray, with ICRC and World Health Organization being allowed to deliver medical supplies into the region over the past few weeks. Would you say the supplies that have reached Tigray are sufficient enough to address the medical emergency on the ground right now?
I can say in regard to the drugs like reaching Mekelle currently, it's a drop in an ocean. You know, they are using it for political purpose, by the way. The propaganda is much louder than its practice. Yet we have received only less than 7%. While we are demanding a lot. Yes, I'm telling you, by the way, about the 2 months minimum stock period only, by the way. So 93% still we're looking forward to get the support. In the first place, people are like counting the number of flights. In every flight, especially when we are like, when IRC was like starting to lift the medical equipments, by the way, in every flight, they were carrying only 1 metric ton. In 15 flights, they brought 15.8 metric ton. In fact, these days, they're using cargo. But still, the cargo they are using is very small, by the way. So, we have plenty of patients under follow-up. More than 100,000 patients under chronic follow-up, like for non-communicable diseases. Diabetes, hypertension, kidney, cardiac patients, and then the like. We have more than 43,000 HIV patients. Can you imagine? Still, we didn't get any drug for HIV patients. We are using, the lucky health facilities are using expired drugs to treat their patients, the HIV patients. We don't have drugs for HIV patients, by the way. We're using expired drugs. We're using expired drugs to treat scabies. We're using some important reagents, expired important reagents, by the way. So still the problem is as it is. In fact, using this opportunity, I would like to thank ICRC, UNICEF, WHO, World Vision, and other implementing partners for their effort. They are trying their best to help us in this regard. But from the Addis Ababa, from the government side, still the problem is as it is, by the way. They're not supporting. They don't want to send drugs. They want to distract the people. They want to perish the people. This is a continuation of the genocide. So they are joking on it, by the way. So be it the international community, our people should understand that we are not receiving enough drugs. Yet we received only less than 7 drugs. It's not only that, by the way. Mekelle is like serving as a warehouse. Yes, it's reaching. The 6% drugs are reaching Mekelle. I know. Everybody knows. But because of the fuel shortage, we didn't dispatch those drugs to the health facilities. So still, people in the countryside, people in the other towns, they are not like getting even the drugs because of the transportation. So still we are tied. Our hands are tied. So they are intentionally working on it. So the international community and the UN agencies should know and understand what is going on in Tigray. Still we're suffering a lot. People are suffering a lot.
Abiy Ahmed's government and other international parties claim that the humanitarian aid is not able to reach Tigray due to the conflict on the border between Tigray and Afar. What would you say to this?
Basically, it's joke. For me, it's joke. In the first place, by the way, it's not the only route we have to Magala or to Tigray, by the way. We have more than 10 alternative routes if you want to come to Magala or to Tigray. There are options, different options. They are doing it intentionally, by the way.
Okay.
So there are also another alternatives, I can say. It's not only these routes, by the way. There are different experiences worldwide. Airlifting with big cargos. There are also cross-border operations. It has been experienced in different countries, be it in Syria, Yemen, and the like. So if they want to support, and me, as the Regional Health Bureau, I have been, by the way, trying to look at the experience of different countries. You can imagine. Still, be it the international community, the UN agencies, they are like issuing their concerns only, by the way. Rather, they are not action speaks louder than words. They have to support an inaction. As people are like dying every day, but still the government in Addis Ababa is joking on us. So we have many alternatives. If they are like willing to support, they can use different routes.
We can also remember what the Afar regional president said.
Yeah, they're using the public medias with no shame and with no fear. They're saying he doesn't want to send any food item to Tigray, and he wants to see people dying because of this. Yeah, we're hearing, by the way, direct from the public medias they're using.
What would your message be to the international community on what's happening in Tigray to lift the siege, to open the siege and everything?
Yeah, we're really suffering. We're trying our best to support our people. Our health professionals are working day and night to serve their people as well. But from the international community side and from the UN side, still we're looking forward to get more support. And the international community should act immediately for peace resolution, and also address the basic life-saving humanitarian aids. Otherwise, many people, will perish. So we are part of the globe, and we need your support. I didn't hear, by the way, I didn't see the people like sieged for long period of time like Tigray. So we are part of the globe. We are Africa. So please help us in this regard. Otherwise, the tragedy is coming, by the way. Thank you very much.
Thank you so much, Dr. Hagos, for your time.
Thank you very much.
And that's it for today's Direct Talk. Thank you for tuning in. See you back here next time with another guest. Bye for now.